All right, so let's quickly talk about the Postemski method of what hernia repair. Okay, Postemski method of hernia repair. What's happening? All right. So in talking about this Postemski method of hernia repair, it is also known as what Retrofunicular Postemski Technique surgery. Okay, or you could just simply say Postemski method of hernia repair. So it's actually what a surgical approach for hernia. All right. So talk about the indications. That's indications is like when to do a Postemski, which disease conditions. I say disease condition. Which types of hernia will you need to actually do this type of surgery for? Then the technique, that's how to do it, the advantages, then possible complications that could result from this technique. All right. So for the definition, we say that the Postemski method, also known as what retrofunicular Postemski technique, is a surgical approach for hernia repair. Specifically, it is done for what? Two types of hernia. So it's either the patient has inguinal hernia or femoral hernia. So coming here now, you see this picture has what different types of hernia, right? So this is a femoral hernia, and this is what inguinal hernia. You get. So if the patient has any of those two, all right. So indications: if the patient has inguinal hernia, then femoral hernia. Okay. Then if this inguinal hernia or femoral hernia is recurrent, so that means the patient had a hernia and you repair it, is coming back. So if this type of surgery can be done for a recurrent hernia, that's said that it's a very good surgery, okay, that can basically permanently take the hernia away, okay. Then if the hernia is large or complex, you might still want to do what? A Postemski method. Now, going to the technique now, first of all, you have to position the patient so the patient should be supine, okay. Then skin incision, so you can do a transverse or longitudinal incision, and that's depending on the hernia location. Okay. Then dissection now. You dissect what? Retrofunicularly. That means you are dissecting in between the external oblique and the transversus abdominis muscle. So that's why they call it what? A retrofunicular what? Postemski method. The exposure, you expose the hernia sac and the surrounding tissue. They now excise the hernia. So when you excise the hernia, um, the next thing you are doing is mesh placement. You know, we have spoken about mesh placement, where we are saying that for you to seal up a hernia, you basically need a strong something to basically cover it. So you now place the mesh and tissue reinforcement. So after you place the mesh, you now suture all the sutures that are supposed to do. The closure, you now what? Close the layers of the muscles and the skin, right? So what is the advantage of this Postemski method of hernia repair? It is minimally what? Invasive. So you don't really need to cut the patient so much like other methods of hernia repair, okay? There's reduced tissue trauma, there's faster recovery, and there's a lower risk of complication. And there's also improved cosmetic result. That means the patient will heal beautifully. All right. Scars will not be too much. You get. All right. So you can see this is it. Not really clear though, but you could just have an idea of it. Okay. This is an incision, and when you're done, basically suture it up. You get. All right. So the complications, every surgery is a surgery. So every surgery, the complication is possibly infections or bleeding, nerve damage, seroma or hematoma, right? That's accumulation of blood, right? Then there also a risk of what? Hernia reoccurrence. Okay, it's not 100% um, sure that it's not 100% sure that the hernia will go away. Okay, so there's a risk for reoccurrence. Okay, so that's it for what? Retrofunicular what? Postemski technique surgery. That's for hernia repair, or it's simply called what? Postemski method.